Salford Clinical Commissioning Group, or CCG, decides how to spend the local NHS budget on most health services for the 270,000 people registered with a GP in Salford. This includes the care and treatment you receive in hospital, maternity services, community and mental health services, and most GP services. Every GP from the city's 44 practices is part of Salford CCG. As a CCG, we work hard to understand what's happening in Salford communities to make sure the best health services are available. In this film, we'll look back at 2017 and 18 at NHS Salford Clinical Commissioning Group. We continue to invest in community-based services, like GPs and pharmacists, to increase the care provided outside hospital. For example, the new Salford-wide Extended Access pilot gives all residents registered with the Salford GP access to primary care evening and weekend appointments. We commissioned an acute home visiting service in Ordsall, Claremont, Walkden and Little Hulton to improve home visits and increase capacity within GP practices. With Salford City Council and wider partners, commissioned a community eating disorder service for children aged up to 18. In partnership with Salford City Council and NHS Bolton Foundation Trust, we developed the Ingleside Birthing Community Centre, which opened in April 2018. We approved plans for a new £4.6 million health centre in Little Hulton. We also agreed to fund Go to Physio, a self-referral physiotherapy service. Impaired glucose regulation exercise service to tackle physical inactivity and weight issues for those at risk of diabetes. Web-based support to help people living with inflammatory bowel disease manage the conditions themselves. Changing behaviour. In partnership with Salford City Council, we set out to encourage people in Salford to change their behaviour to stop themselves from getting ill. Looking after themselves more when they do fall ill will make a big difference on demand and dependency on health and care services. In 2017-18, Salford was awarded £3.4 million from the Greater Manchester Health and Social Care Partnership to improve population health. We're going to use this money for areas like training for frontline staff to identify mental health needs and early help for families. Our Innovation Fund is used to test new ideas that could make a difference to the health of people living in Salford. For example, our GP Desensitisation Resource Box. People with learning disabilities tell us fears around medical equipment, and not knowing what to expect at doctor's appointments stops them from going for routine health tests. The box has some common medical equipment, so people with learning disabilities can learn about, touch and explore medical equipment, reducing their anxiety. Our minor illness workshops are for parents, carers and children to build parents' knowledge and confidence to manage children's minor illness at home without going to the GP or A&E unnecessarily. In Salford, every year there are around 21,000 people experiencing a common mental health condition. We invest £40 million each year on mental health services and plan to increase this by around £1 million each year for the next 3 years. In partnership with other organisations, we launched the Salford Suicide Prevention Strategy to stop people seeing suicide as their only answer to their problem. We invested in a mental health police interface team, where a mental health practitioner is co-located with Greater Manchester Police to manage the high volume of calls. We approved plans to develop a 2-year pilot to improve support for people with secondary care mental health problems to keep them in employment. Working with Salford's Health and Wellbeing Board, We worked with the first Boothtown brownies to tackle tooth decay by creating a new Sugar Smart badge. We created a workforce walking challenge for employees from across the NHS, Salford City Council, Salford Fire Service and the voluntary sector to practice what we preach. We launched a falls prevention campaign, promoting 6 simple exercises and advice on home hazards to tackle Salford having one of the highest rates of falls causing injuries requiring hospital admission amongst older people in the UK. The Third Sector Fund. The third sector is delivered by Salford CVS and funded by Salford CCG with the support of Salford City Council. Set up in 2014, the fund has awarded grants to over 174 voluntary organisations, community groups, social enterprises and schools. In 2017-18, we announced a further £3 million to be invested into the Third Sector Fund over the next 3 years. Salford Together is a partnership between NHS Salford CCG, Salford City Council, Salford Royal NHS Foundation Trust, Salford Primary Care Together and Greater Manchester Mental Health NHS Foundation Trust. Council staff and health staff work together to create a more joined-up system that focuses on a person's individual needs to keep them out of hospital and receive care closer to home. In 2017-18, Salford Together spoke to 4,000 Salford people for their views on how to improve local health and care services through the Big Health and Social Care Conversation. They launched a GP streaming service in Salford Royal A&E to redirect patients coming to A&E with a primary care need to a more appropriate service. They worked towards increasing the number of referrals to the Salford Falls service to prevent falls in later life, which can lead to serious injury and hospital admission. We're proud of the work from 2017-18, but will continue to work hard to improve health and social care in Salford in 2018-19.